Hi, I am Dr. Mangesh Kamath. I am a senior medical oncologist practicing at Helios Cancer and Hematology Clinic, Bengaluru. In this video, I would like to guide the attenders and relatives of the cancer patients on how best to take care of the cancer patient. The cancer treatment journey is one of the most hectic journeys that patients undertake. It is important for relatives and attenders to understand that the cancer patient not only carries the anxiety of cancer spreading and progressing during their cancer treatment, but is also thinking about what will happen to his or her children if they die due to cancer. In my experience of treating cancer patients, I have found that even if I tell the patient that your cancer is in the earliest stages, the cancer is still scared and thinks that things can go wrong and some bad things can happen due to which the person may not survive cancer. So the first and most important thing that the attenders and relatives should do is constantly communicate with the oncologist. Now, why is this important? One is to understand if the treatment is working. Two, is there something else that the doctor is thinking of doing so that the treatment can be successful? And three, make sure that you prepare in advance for whatever advice the oncologist gives you. This is very important. That is communication. Next is preparation. Make sure that you are ready to take care of the patient emotionally. It is not good for you to look depressed and hopeless in front of a cancer patient because that makes the cancer patient feel even worse. So make sure you prepare to be mentally strong. Remember folks, cancer in the earliest stages is highly curable. There are many common cancers today which in the stage 1 and stage 2 are curable in more than 90% of cases. So once you get the right information from the oncologist, make sure you believe that you are going to be on the positive side because life is about being positive. So prepare very well to make sure that you take care of the patient financially. Make sure that you're ready. Make sure we are logistically ready. Make sure that patient reaches on time, takes treatment on time. Make sure that the patient gets the right food on time, gets the right amount of exercise, right amount of emotional support, a lot of happiness at home. Make sure the home environment is very nice and there is a lot of positivity at home. So these are very important. It's like what we tell to children. You may be at school for 6 hours, but even the atmosphere that is at home goes a long way in determining the life of a child. So same way, you may be coming to the oncologist for maybe 2 hours, 3 hours, or maximum 6 hours, but the rest of the day is very important for making the cancer patient feel very secure and in a happy space. The next other important thing is if you unfortunately land in a situation where things are not going in the way, make sure you still remain positive in front of the patient. You may yourself be disappointed, unhappy and anxious, but make sure you are still positive in front of the patient. Communicate with your oncologist on how best we can overcome this difficult situation in case you encounter any. Also make sure that you discuss all aspects in detail to the best of your understanding about what could be the financial backup required and how best to take care of things in case the patient is going to succumb to cancer, how to make sure that the patient is symptomatically in a good space. If patient has a lot of pain, make sure you communicate with the oncologist to take care of the pain, reduce the pain to the minimum possible. If patient has other inconveniences which are hampering his or her activities or daily living, make sure that is also taken care of. So this is basically a video created to tell you as to what you should do during the entire course of the cancer treatment. So if there are any questions, please mention the same and I will answer it to you individually. Thank you.